Welcome to Legal View. I'm David Hogg, and this is Aaron Gartland. Tonight our guest is Dr. Bob Carnes of Carnes Chiropractic and Wellness Center in Dothan.
And tonight on the Legal Brief, David and I are going to be discussing the importance of following up and getting the proper treatment and care after an accident or an injury.
American law is complex and not always easily understood, so a little help and advice can go a long way. The attorneys of Hogg and Gartland Law Firm in Dothan present Legal View.
The Legal View with Hogg and Gartland.
Dr. Carnes, welcome to the show.
Thank you. It's good to be here.
Yeah, and we're certainly glad to have you here. Now, you and I have known each other for some time as I've been, one of your patients for several years now, and also consider you a friend. But for the people that, that don't know you and aren't familiar with your practice, tell us a little bit about your practice.
Okay. Well, the name of our practice is Carnes Chiropractic and Wellness Center, and we're located on West Main Street, and we've been there for 30 years next year. We call it a wellness center because we like to say that we're trying to bring wellness to the wiregrass by helping people get on a wellness track that goes beyond the back. Because when you think of chiropractic, mainly you think of back problems, which is an important part of our practice, but we like to go beyond that and treat the whole person and get to the root cause of their problems, whether it be a digestive problem or what's causing their migraine headaches and just a number of things. And I know working with you, you had some issues other than just back problems that we worked on that we were able to help you with.
Yeah, absolutely. I know several years ago when I came in, I was, having some trouble sleeping, and I felt like I had a, good diet and exercise program at that time. But it was in, getting into, the mid-30s, and I felt like I needed to actually tweak my diet and exercise program, and you've certainly helped me, tremendously with that.
Mm-hmm. Yeah, and what we try to do is basically follow 7 steps to make it simple to care for your temple. Now, we didn't say that they were easy, but they're simple. And so we like to keep it real simple for people because it really is that simple. So like the first step is to think well, become knowledgeable about your body. And a lot of people just don't know anything about their body and how to take care of it very well. For an example, I usually take a diet history when my patients come in. And I had a lady come in the other day and I said, well, what do you have for breakfast? And she said, well, I have a very healthy breakfast. I have good blueberry morning cereal for breakfast. And when you look at blueberry morning cereal, it looks like it's real healthy on the front of the box. But when you look at the side panel and start reading what's in it, you realize that there's about 5 different entries there of sugar. And there's something like 48 grams of carbohydrates in the cereal. So it's not really breakfast cereal, it's really more like dessert. But she thought it was very healthy. So we try to educate people on what they can do to learn more about their bodies. Now, I don't know that much about cars, but I know enough to know what I need to do, to who to take it to, and to get the right work done on it. So,
and I guess how to maintain it.
Yeah, how to maintain it.
In between taking it in to have it worked on.
Exactly. So that's a big thing, is to just begin to think well about your body, and we try to teach people that way. The number 2 is to eat, drink, and supplement well. And that's eating right is just so important. And people want to know, well, what do I eat? And I just simply tell people to eat the foods that God made. God didn't make Twinkies. And Twinkies are not going to fuel your body like it needs to be fueled for it to be healthy. So we teach them how to eat properly and then supplement well. There was a study that was done years ago. It was a Senate study, and they came out with a Senate document that said that 95% of people are missing one or more major minerals. And this study was done in the 1930s. So you can see where we are today is probably a lot worse than that. You know, our ground is depleted. So even the AMA has come out and said that we need a good multivitamin and mineral every day to help prevent the chronic degenerative diseases that are affecting so many people, like heart disease, stroke, diabetes, cancer, and those degenerative diseases. So what we recommend is that people have a good multivitamin and mineral. That's number one. There's 4 of them. Also to take probiotics, and you're taking that yourself.
Sure.
That's to help supply the good bacteria to your colon so that you digest well, your B vitamins, as well as helping your immune system. And then enzymes to help you break down your food well, because the level of our enzymes decreases the older we get. So we have to have that. And then the 4th one is fish oil, some kind of omega-3 fatty acid. And I know you're taking that as well.
Yes, as well as the multivitamin.
Exactly. And
yes.
that's going to help you with your cardiovascular health. It's going to help decrease your triglycerides, your cholesterol, and it helps decrease inflammation, which a lot of people aren't aware of, the omega-3s and dealing with inflammation. So we got to eat well, take supplements, and then drink well. We're talking about drinking water. Now, if you're drinking Dr. Pepper, you're going to the wrong doctor. I've heard that he's kind of a quack doctor. So, but a lot of people are, and we try to get them changed over to drinking just purified water. Some kind of purified water, whether it be reverse osmosis water is very good, and to drink 64 ounces a day minimum, because our bodies are 60% water. Some parts are even more than that. Our brain's more than that, and our digestive organs have to replenish their lining, and that's made of water. So a lot of people, what I tell people is to take the water challenge, and that is to drink 64 ounces of water a day for 2 weeks, and I guarantee them that they will improve in some symptom that they're having, either eliminate it, like if they're having reflux or some other problem. Most of the time, something disappears by drinking water.
And that's about 8 glasses,
8 glasses a day, yeah.
and just spread
Minimum.
that throughout the day.
Exactly, yeah. And then if you're working out and sweating a lot, or you're drinking coffee and a lot of tea, things that are dehydrating you, you're going to need more than that. So you got to take that into account. And then the 3rd step is to maintain a balanced nervous system by removing the 6 interferences to your nervous system. And so we're going to go through those 6. And the first one is structural. And we talk about structural interferences or structural stresses to the body. We're talking about what we think about chiropractic. Coming in for musculoskeletal problems, muscles out of balance, your spine being out of alignment, irritating your nervous system. That's where we're removing those interferences by chiropractic adjustments. That's our structural effect. And then to help that structure hold, we recommend people exercise 3 ways: cardiovascular, stretching, and strength training. And it's important to realize that you're never too old to start. I read a study the other day. It was one that was done in a nursing home, and they had I think it was about 19 senior citizens. They were 80s, around the 80s, 87 or so, and most of them were in wheelchairs. And they had them exercise 10 minutes a week for 14 weeks. And at the end of that time, the majority of them were out of their wheelchairs, and one actually went back into assisted living from the nursing home. So I mean, that's very minimal, and yet they got that kind of results just by doing some strength training. It's phenomenal. So we really encourage people to exercise to maintain their structure with 3 different areas. And so that's the structure. Then you've got electromagnetic fields that can interfere with your nervous system. A lot of people aren't aware of that. But your cell phones, computers, people that are in front of computers a lot, they're getting that electromagnetic field from that, and that is interfering with their nervous system function. When you think about it, years ago when I came up through school and we took typing, we didn't have computers, we didn't have electric typewriters, we had the manual type. and that's what secretaries worked on. But you never heard a lot about carpal tunnel back then, carpal tunnel syndrome. But now you hear about it a lot because they're in front of that computer, and those electromagnetic fields are weakening their nervous system, weakening their muscles, and they're getting inflamed, even with slight extension of their wrists, and that's causing the carpal tunnel, which is rampant now. So the electromagnetic fields, if you Google that, electromagnetic fields, you'll be there all day reading information about the effects of that on your body.
How about just the light, like late at night, being on the computer, the light stimulating you and keeping you from wanting to go to sleep?
Yeah, exactly. That's one of the big no-nos for people who have trouble falling asleep, because your pineal gland up here in your brain produces melatonin. And melatonin is produced whenever it's dark. So that's why it's very important whenever you're getting ready for bedtime to get the lights low so that melatonin can be released so that you can move into sleep. So that's good, yeah, that's important. And then the next one we have here is nutrition. And we talked about that a little bit already. But a lot of times people need target nutrition for certain organ systems that aren't working like they should. Let's say, for instance, you've got reflux problems. Most people are going to go to the doctor and get some kind of a antacid, like Prilosec or something like that. Well, that's just going to decrease your acid, and that may not even be the problem. You may need more water, but you may need target nutrition to help heal the lining of your stomach so that you don't have the reflux problem. You may even also need extra hydrochloric acid, because we have that in our stomach anyway. But from the age of 25 on, that level decreases. And if you don't have enough hydrochloric acid, you're not going to be digesting your food. Instead, it's going to sit in there and ferment, which creates a lot of gas and bloating, and it's not going to be digesting like it should. So that's a good key. If you have a lot of gas and bloating, you know that you probably don't have enough hydrochloric acid. That's a possibility. So we try to find out if a person needs target nutrition for different things. We work with thyroid problems, adrenal problems. We're in a stressful world, and people's adrenal glands get exhausted. So, I think we talked about that some when
Absolutely.
you first came in. Yeah, because you were burning the candle at both ends and working hard, and just got fatigued and exhausted, and you needed that adrenal support.
Dr. Carnes, that I think one of the issues with me was overall I had a pretty healthy diet and lifestyle with nutrition and supplements and exercising, but I think there were some things like you had mentioned with the Dr. Peppers, and I wasn't a big Dr. Pepper drinker, but I did drink at that time a lot of Coke and sweet tea, and now I've pretty much gotten to the point that I just drink water exclusively. I mean, that's pretty much all that I ever drink, and I typically take in at least a gallon a day, and doesn't that the sugar and the carbonation, doesn't that make it harder for the body to take in all the nutrients, and then also make it harder on the adrenal system?
Absolutely.
When the body's having to deal with all that sugar and the carbonation and the caffeine and all. That was one of the big issues with me.
Yeah, and as long as you're stimulating the adrenals with caffeine or sugar, they're not going to be healing. They're not going to be improving. So what happens is the more exhausted they get, the more people begin to depend on caffeine and sugar to keep them propped up, keep them going. It's classic when somebody says, when I wake up in the morning, if I don't have my coffee, you don't want to be around me. They've got to have some stimulation. Well, that's when they come in and say that, I know right away, most of the time, they're going to be adrenal fatigued, and they're going to need support there. So that's what we try to do, is go in and support those areas to get them healed up, rather than, and looking for the root cause of the problem, rather than just, taking a pill to kind of cover up the reflux. Let's get to what's actually causing the reflux or whatever the problem is. So that's what we seek to do.
And then, Dr. Carnes, with the adrenal function, you talk about the acid and the root cause of the reflux, but with the adrenal, for me, and I guess with a lot of your patients, isn't it just having trouble getting to sleep and not getting enough sleep? I mean, isn't that one of the big
Sure. Yeah.
issues that
That's
people.
huge. And you mentioned about the light and how that affects the melatonin, but with the adrenals, what happens is the cortisol from the adrenals, which is one of the main adrenal hormones, gets released at night, and that wakes a lot of people up, particularly if they're hypoglycemic. And we do a lot of blood work in our practice, and if a person is hypoglycemic, and as they go to sleep, then as their blood sugar drops, their body is going to release cortisol to get the reserve sugar out of the liver, and that's going to wake them up because cortisol is a stimulatory hormone. And another thing that happens a lot of times is the cortisol gets high at night. It should be low because it's a stimulatory hormone. So we have supplements that help lower the cortisol at night, and then that helps a person go to sleep. They'll come in and they'll say things like, I'm tired, but I'm wired. I can't turn my brain off. Well, that's a classic symptom.
And that wouldn't that be described as an adrenaline rush?
Yeah.
When it's similar
Exactly.
to somebody getting excited and
Yes.
hyped up and getting that adrenaline rush.
Yes, exactly.
Which in under the right circumstances, it's a good thing for the
Yeah.
body to have that. But if it's not at the right time, it's going to keep you up all night.
That's right, exactly. And so we try to deal with that with lifestyle changes. We had a patient the other day that was just drinking a couple of coffees in the morning, a couple of cups, and they eliminated that and the sugar, and they said it was amazing how much better they slept. And they were kind of thinking they could get away with it if they did it early in the morning, but even that amount was significantly affecting their sleep.
Could excessive adrenaline lead to other problems like high blood pressure or something like that?
Absolutely, absolutely. It leads to that. It leads to stomach problems because that cortisol will cause the lining of your stomach to be eaten away, and then that can lead to ulcers and reflux disease, also inflammation. And inflammation is now implicated in anything
Just
from
about sure.
heart disease to Alzheimer's disease, just about everything.
Kind of like stress is involved in just about any kind of condition.
Exactly, that's right, yeah. So then the next interferences is allergies, and allergies are huge. Most people think, when they think about allergies, they're thinking about nasal, something nasal.
Peanut dust.
Yeah, peanut dust, or my nose is running, or I have asthma, or something like that. But it's much more extensive than that. We found people with allergies triggering their migraine headaches, triggering their high blood pressure, triggering their stomach problems, just rampant.
Like food allergies.
Yeah,
and
food
different
allergies,
things.
airborne allergies, all of that. And we treat that. We find out what they're sensitive to using a technique called applied kinesiology. This is where we use muscle testing, and we did some of that on
Sure.
you. And it's really fascinating how that works. And so we actually find out what they're sensitive to and then desensitize them to the food or the airborne substance using a laser technique. We actually have a new system. It's called the LZR7 allergy relief system that is very comprehensive now and can test for really literally thousands of things and then desensitize the person to those things. So we're very excited about that.
So if someone is allergic to peanuts, you can make them where they are able to be around peanuts or eat peanuts without having allergic reactions?
Well, what we say is we seek to balance the body in that area. We don't say that we treat anaphylactic type reactions, but we just seek to balance the body, and a lot of times there's significant improvement with those types of things, yes. Mm-hmm. So the fourth step is to play well by getting adequate exercise. Now, jumping to conclusions is not considered adequate exercise, but a lot of people, that's all they get. So, but we talked about that a little bit already.
Sure.
The importance of stretching, importance of resistance training, and cardiovascular, all three of those. And you don't have to do but about 20 minutes, 3 or 4 times a week to really be adequate. And then we've got number 5, That step is to let go of stress well. And we've talked about that a little bit already too, the importance of, well, we like to say that Philippians 4, 6, and 7 is a great blueprint for how to let go of stress well. And it says, do not be anxious about anything, but in everything through prayer and petition with thanksgiving, present your request to God. And the peace of God, which we're all after, peace in our lives, which passes all understanding, will guard our hearts and our minds in Christ Jesus. So that's what we preach all the time for letting go of stress well. And then the sixth one is in the day well with adequate sleep. And what's adequate sleep? Well, the studies show about 8.5 hours. And very few people get 8.5 hours sleep a night. So we encourage people to get in bed by 10, because after that you usually get something called like a second wind. You come alive again. You probably experienced that before. Most people have. So that's very important to get adequate sleep. For weight loss, we've seen that. I know, Aaron, you lost significant amount of weight with your
Sure.
wellness program that you went on, and you started sleeping more, you started drinking your water, working out, eating right, and you just did tremendous with that.
Sure.
So then the seventh step is to stay the course well with coaching, encouragement, and prayer. And that's what we seek to do with our patients, is to coach them, because it's not just a sprint, it's a journey. Wellness is a journey. And a lot of people just need a plan. Many people have a legal plan. They do financial planning, and we should do that. But how many people actually have a wellness plan to stay well? Not very many people do.
Well, Dr. Carnes, if one of our viewers wants to schedule an appointment with you, how can they reach you?
They can reach me at 794-2225, or they can go to our website also. It's carneswellness.com.
Well, we've certainly enjoyed having you on the show. Thank you for being here.
Thank you. I've enjoyed it.
Well, so much of what he talked about, to me, carries over so well into our legal brief tonight, talking about continuing your treatment, continuing to improve your health and wellness after an accident. And, I can think of a couple of good examples of why it's so important to continue your treatment. One thing is, you don't want to appear to be malingering. If you've been injured, the defense can claim that you're malingering. You're not getting well on purpose. You're exaggerating your symptoms. If there's documentation that you're doing everything you can to get better, to improve your health, to recover from your illnesses, then that is not a defense that can be raised. And certainly it can be shown that you're doing everything that you can to get well.
Yeah, David, that's right. Something that we tell people, you certainly can't, live your life based on how it's going to impact your case. But just as a practical standpoint, in order to heal and be healthy, you just need to follow up with your treatment, follow up with the advice of your doctors. If you're prescribed physical therapy or some type of treatment, it's going to be best for you generally to go in and get that care, get that treatment, and it's just going to help the recovery process. And as you point out, it's also from a standpoint of having a claim or a case, it's going to help your case. You brought up a great point about the potential for malingering, and even if a person's not malingering, just given the appearance that they're malingering, not cooperating with treatment. And something else that kind of ties into that is, we tell people that have been injured, not to exaggerate your injury, to us or to your doctor, but at the same time, don't minimize it either.
And when you say not to minimize your injury, expand on that some. What are you talking about?
Well, David, I know you've seen these cases, and I'm making a generalization here, but it comes up from time to time where we have a client come in the office and it's almost like their wife kind of drags them in kicking and screaming a little bit that they've been injured, whether it's on the job or in a car wreck, and they've got a neck or back injury, and they say they're okay, but yet they can't work. They can't do the things that they were doing before the accident, before the injury. And their wife and the people that are around them, their friends and family, they see it. You know, they see, hey, Dad can't get out and cut the grass like he once did, or whatever, and they're actually minimizing their injury.
Yeah,
They're
maybe
saying,
they feel like if they tough it out or if they just wait it out, it'll go away, they'll get better. They feel like they need to be strong, but that's not the best thing for the case. That's not the best thing for their health. And
That's right.
if they don't go for treatment, well, we've talked about gaps in treatment before.
Yeah, and that's in kind of, I guess, one example of a gap in treatment. And just to expand on that, that can come up in a couple of ways. You know, one way that can come up is someone's injured or they're in an accident and they wait a month or more, or maybe even a few days before they get checked out and get treatment. And, you know, that's going to, again, hurt their chances of recovery, and it's also going to hurt their case.
So go to the doctor as soon as possible after an accident. Cooperate with the course of treatment. Get regular checks. Go to the doctor regularly and do everything that you're told so that you can maximize your potential for recovery.
David, another way that a gap in treatment occurs is where you have a situation where maybe a person did seek medical treatment right after their injury, but then they wait a month, or maybe they've been treating for a month or so, and they don't follow up with their treatment. So you may have a 30 or 60 or 90 days or more without treatment. And that can really, again, hurt a person's chances of recovering and healing, and also it'll hurt their case, because the defense lawyers, they love that. The insurance companies, they love to see that, because it gives them ammunition to go in at a deposition or a trial and say, now, doctor, if they would have followed up with their treatment, you know, would their chances of healing have recovered? You know, so hey, if they're still complaining of hurting and being in pain and they can't do the things they once did, well, hey, maybe if they would have gotten their treatment like they were told to do, they'd be better now. The other way that hurts the case is it sets it up where even if you are in pain and you're hurting, it makes it not credible, because the defense lawyers are going to say, you know, look, if this person was really hurting that bad, they had treatment, they went to the doctor, they didn't follow up. So you can't really believe, you know, it's not believable.
Well, thanks again to our guest, Dr. Bob Carnes of Carnes Chiropractic and Wellness Center. We'll see you next week.
Good night.
To submit legal questions you may have, email to aaron@hoggartlandlawfirm.com. Thanks for watching. This has been a production of the Hogg & Gartland Law Firm and WDFX-TV, Fox 34.
The Legal View with Hogg and Gartland.